Hello, I'm Dr. Gunamani Rabha, Assistant Professor, Department of Anatomy, Diffu Medical College, and he is Dr. Baneswar sir, Associate Professor, Department of Anatomy, Diffu Medical College. We are now going to say about the pharyngeal arch arteries and their fat. So these are all handmade models which are made by our Dr. Baneswar sir. Now today we are going to say about the book, which are our reference book from this Langman 12th edition, and this one is the
missing 8th edition.
This one 8th edition in the Brissings. Okay, so these are books for our reference.
So these are the diagrams. These are the diagrams. This is the sagittal section of this blastocyst. This is the sagittal section, and this is the cross section of the blastocyst. So here we can see the craniocaudal folding. This is called craniocaudal folding. Craniocaudal folding. By the end of this craniocaudal folding, we can see the formation of the foregut, midgut, and hindgut. Okay. Then in the cross section, so these are the endocardial tube. This is the formation of the heart tube. Of the heart tube. Okay. Now, so this is the model of pharyngeal arch. These are the pharyngeal arches. Here also, this is
and
the
models. Okay.
Pharyngeal arch. So here you can see these are the thickenings of these pharyngeal arches. So
Mesodermal thickenings.
So this is also a model of
pharyngeal arch.
Pharyngeal arches. So there are 6 pharyngeal arches: first, second, third, fourth, fifth, and sixth. But the fifth one disappears. So this is the pharyngeal arch. So the definition of the pharyngeal arch is the mesodermal thickening of the cranial most part of the foregut. Mesodermal thickening. So this mesodermal tissue will get this bone, cartilage, muscle, nerve, arteries, and ligaments. So this is the fusion of the heart tube. This is the arterial end and this is the venous end. So the basic part of this fused heart tube, bulbus cordis, ventricle, atrium, and sinus venosus.
Anterior to posteriorly.
So this part is called bulbus cordis. Bulbus cordis is again divided into truncus arteriosus and conus. So this end is called arterial end and this end is called venous end. So today we will discuss only this arterial end, which will be connected with the pharyngeal arteries. So this is the spiral septum. So this spiral septum is separating the truncus arteriosus into pulmonary trunk and aorta. So okay. So this is the bivas. So here also this is the.
In this model, we can see the spiral septum inside. Yes. Already we have discussed this part.
Yes, already we have discussed. This is the spiral septum. So this right ventricular blood will be taken to the left side as a pulmonary trunk, and this left ventricular blood is coming towards the right side as a aorta.
Okay.
Then so this is the fetal arch arteries. So here also you can see this is the model. Following this diagram. So this is the bivas, bulbus cordis, ventricle, atrium, and sinus venosus. So this is the venous end and this is the arterial end. So this is the dorsal aorta. As per this diagram, this diagram, this is the dorsal aorta. Can you focus it? So this is the dorsal aorta, and ventrally this is the heart tube, fused heart tube.
Okay.
Then, so this dorsal aorta will be connected with this arterial end of this fused heart tube. Okay. So this arterial end of this fused heart tube is the bulbus cordis. This is the bulbus cordis and this is the dorsal aorta. So dorsal aorta and bulbus cordis.
That means 2 dorsal aorta
here.
Here
2 right and left dorsal aorta. And this is the bulbus cordis. The bulbus cordis, most terminal cranial part is the truncus arteriosus. So above this truncus arteriosus, there is a part that is called aortic sac. So above this truncus arteriosus, there is a dilated part that is called aortic sac. So this is called aortic sac. Aortic sac is the most cranial part of this truncus arteriosus, which is dilated. It is dilated. So now this bulbus cordis, this cranial most part of this bulbus cordis, the aortic sac will be connected with the dorsal aorta, right and dorsal aorta. So these are the pharyngeal arch arteries. Pharyngeal arch arteries. So these are the IB Singh book diagrams. This one also IB Singh book diagram. So here you see this is the dorsal aorta.
Okay, these are two dorsal aorta.
This is the two dorsal aorta.
Here in this in the model, these are
dorsal aorta.
Two dorsal aorta. Okay.
Yes, dorsal aorta. And ventrally is a fused heart tube.
Ventrally they are going to fuse and form the heart tube. Okay.
So this most cranial part of this truncus arterius is the aortic sac.
Aortic sac. This
aortic sac. ठीक है sir? Aortic sac.
Okay.
So these pharyngeal arteries, pharyngeal arch arteries are coming to this aortic sac. So this is the aortic sac. This is the aorta and this is the pulmonary trunk. Okay. Already we have discussed.
Okay. Huh? These two part already discussed.
Already discussed here.
And this model.
This is the in this model. This is the truncus arteriosus.
Okay.
Arterial end. Truncus arteriosus is divided into halves. Pulmonary trunk and
aortic.
Aorta. So here it is the aorta. This is the aorta. Aorta and this is the pulmonary trunk.
Okay.
Okay. And posteriorly these are the two right and left dorsal aorta. As per this diagram. As per this diagram, I have made this model.
Okay.
So, okay, sir. Okay. So this is the dorsal aorta, right and left dorsal aorta.
Okay.
And these are the pharyngeal arch arteries. These are the first, second, third, fourth, fifth, sixth. There are 6 pharyngeal arch arteries. First,
both
second, third, fourth, fifth, sixth. Okay.
Okay.
So they are connected entirely with the arterial end of the truncus arteriosus and posteriorly connected with the dorsal aorta.
Dorsal aorta.
Okay. So now you see this first and second, this black. It is
this
looking black.
Yes.
Black means these are degenerating.
Okay.
First and second arch arteries are degenerating. Then fifth one is also degenerating. Fifth one. Okay. Now this is you see this is the part of the dorsal aorta.
Yes, this part
this
also
one is
black.
also this black part is also a part of the dorsal aorta between the third and fourth pharyngeal arch arteries. Okay. This is called ductus caroticus.
Okay.
ठीक है sir?
Okay.
Or carotid duct. It is also known as carotid duct.
Carotid duct.
Okay. So this is also degenerating. This is also degenerating. Okay.
Okay.
Then this is the fifth one. This fifth arch artery is also disappearing. Degenerating.
Okay.
Now see, this third and fourth, the third and fourth proximal part is known as this left horn. This also known as left horn.
This one is left horn.
And this proximal part of this right-sided third and fourth is also known as the right horn.
This one right horn.
Right horn. ठीक है right horn. So this is the right horn and this left horn is connected with this aortic sac. Anteriorly. And the posteriorly this is the pulmonary trunk. So this pulmonary trunk will be again divided into right and left. So this right one is the pulmonary artery, right pulmonary artery, and this is the left pulmonary artery. Okay. Now see this third. This one is called third arch artery. So in the right side you see it will form the common carotid artery. It will form the common carotid artery. So from this common carotid there will be sprouting.
Yes, this one is sprouting.
This is the external carotid artery.
Yes, okay.
This is external carotid. Then this remaining part of this third arch artery, I mean the posterior part, and the upper part of this dorsal aorta will form the internal carotid artery.
Internal carotid
artery. So this is called internal carotid artery.
This one, that means this one is the external carotid and posteriorly this one is the internal carotid.
Actually this third aortic arch artery, proximal part will form the common carotid. So from this common carotid, this is the sprouting, which is known as the external carotid. Then this distal part of this third arch artery plus this upper cranial part of the dorsal aorta will form the internal carotid artery. Okay. Now this is the fourth aortic arch artery.
This one is fourth.
This fourth one will meet with the 7 intersegmental artery. It will fuse or it will continue with the 7 intersegmental artery, and it will be the right subclavian artery.
7 intersegmental artery forms the
No. This part, fourth aortic arch artery plus it will meet with the 7 intersegmental
artery.
Then it will continue as a right
subclavian artery.
Okay.
Okay.
Now see, this is the fifth degenerate.
This one degenerate.
And this is the sixth. The sixth one, this is called pulmonary artery. Six pharyngeal arch artery, which is connected with the pulmonary trunk.
Pulmonary trunk.
Medially, then laterally, the distal part. The distal part will degenerate, and this proximal part will become the pulmonary artery. Pulmonary artery to the right lung.
Right lung.
Okay. So in the left side, you see, in the left side, the proximal part of this third and fourth aortic arch artery will form this left horn. This is the left horn.
Yes.
Then this third one will same as the common carotid. Same as the right side.
Yes.
Yeah?
Common
Common carotid. Then this
sprouting again.
External carotid. Then it is internal carotid.
Internal carotid artery.
Now you see, this is the fourth aortic arch artery, which
this
will form the arch of aorta.
Okay.
So this arch of aorta, I mean this fourth aortic arch will continue in the left side with these 7 intersegmental artery to form the left subclavian artery. Okay. Now see, in the left side, this is the pulmonary trunk. So this pulmonary trunk will continue as a pulmonary artery, left pulmonary artery. And
this one sixth.
This sixth.
This one sixth. Fifth one again. This side also. This one degenerate.
Okay. So in the left side, this proximal part of this 6th aortic arch will form the left pulmonary artery. Then the distal part. The distal part will be the ductus arteriosus. This ductus arteriosus will drain in the left dorsal aorta.
Yes.
Left dorsal. So before the pulmonary circulation of the fetus, so this blood from this pulmonary trunk will go to the dorsal aorta through this ductus arteriosus. So after birth, this ductus arteriosus will be the ligamentum arteriosum. Ligamentum arteriosum in the left side. But you see there is no ligament in the right side.
Yes.
Yes. Now see, this is the dorsal aorta. Already we have discussed about the dorsal aorta. So the major part of the right side of the dorsal aorta will degenerate. This black part will degenerate. Okay. But in the left side, this part will persist in case of the future adult aorta.
That means this one will be the aorta. Abdominal aorta, thoracic aorta part. This part will form.
First of all, descending aorta, then
thoracic aorta in the thoracic part, then abdominal part, they will be known as the abdominal aorta, like this way.
So this is about the pharyngeal arteries.
Okay. Thank you.